Hello, friends. Medicare has just opened a new path that may allow some people with Part D drug coverage to get certain GLP-1 weight loss medicines for $50 per month. That is real. The Medicare GLP-1 bridge began on July 4th, 2026, and it is available nationwide. But the word some is doing a lot of work in that sentence. This is not automatic coverage for every person on Medicare. It does not include every GLP-1 drug. It is not based only on whether your doctor thinks weight loss would help. And one of the strangest parts is that having certain medical conditions can send your prescription through regular Part D coverage instead of this $50 program. That is why people are already getting conflicting answers. One person hears $50. Another is told the drug is not covered. A third person has the right body mass index but the wrong type of Medicare plan. And someone who has already lost weight may incorrectly believe they no longer meet the BMI requirement, even though Medicare looks at the point when GLP-1 therapy began. Today, I am going to explain who may qualify, which medicines are included, the exact BMI rules, the health conditions that matter, what your doctor has to submit, and the extra cost that the $50 headline does not cover. Stay with me, because the rule about diabetes and sleep apnea is almost the opposite of what many people expect. Before we get into it, subscribe to this channel and turn on notifications. Medicare rules are changing quickly, and a headline without the details can be more dangerous than no information at all. I go through the official Medicare and CMS guidance, separate what is confirmed from what is being exaggerated online, and explain what you can actually do next. Let us start with what changed. The program is called the Medicare GLP-1 Bridge. It is a temporary federal demonstration that runs from July 4th, 2026 through December 34th, 2027. Eligible people with Medicare drug coverage can receive certain approved GLP-1 medicines for weight management with a $50 copayment for one monthly supply. The program works nationwide, including the states and United States territories. Your Part D company does not have to volunteer or opt in before you can use it. CMS is using a central processor to handle prior authorization, pharmacy claims, and payments. That does not mean you can walk into any pharmacy today, ask for a weight loss injection, and pay $50. You still need a prescription. You still need prior authorization. You still have to meet the clinical requirements. And the medicine has to be one of the products included in the bridge. As of now, the covered products are Foundayo tablets, Wegovy injections or tablets, and Zepbound in the KwikPen formulation. The bridge does not cover Zepbound single-dose vials or single-dose pens. Medicare says the product list may be updated, so do not assume that a drug is included simply because it belongs to the GLP-1 category. Now, the first basic requirement is Medicare drug coverage. You generally need a standalone Part D plan or an eligible Medicare Advantage plan with drug coverage. Certain special needs plans, employer or union plans, and LINet can also qualify. Call your plan or 1-800-MEDICARE to confirm your exact plan type. If you have Parts A and B but no Part D coverage, the bridge does not create a drug plan for you. Ask Medicare or a free ship counselor when you can enroll and whether a late enrollment penalty could apply. Next comes the purpose of the prescription. The bridge is for eligible GLP-1 treatment used to reduce excess body weight or maintain weight reduction together with an ongoing lifestyle program involving nutrition and physical activity. Your provider has to certify that the medicine is being used in that way. This is not a situation where you complete a short online form and approve yourself. A doctor or other qualified prescriber must decide whether the drug is medically appropriate, issue the prescription, and provide the information needed for prior authorization. Now we get to the clinical rules. You must be at least 18 years old, and you must meet one of the BMI pathways at the time you started GLP-1 therapy. The first pathway is a body mass index of 35 or higher. Under the published criteria, a person who had a BMI of at least 35 when therapy began may qualify without needing one of the additional conditions on the lower BMI lists. The second pathway involves a BMI from 30 through 34.99. In this range, you need at least one qualifying health condition. The public Medicare guidance lists diastolic heart failure, also called heart failure with preserved ejection fraction, uncontrolled high blood pressure, chronic kidney disease at stage 3A or higher, pre-diabetes, a previous heart attack, a previous stroke, or symptomatic peripheral artery disease. The third pathway is narrower. If your BMI was from 27 through 29.99, you need prediabetes, a previous heart attack, a previous stroke, or symptomatic peripheral artery disease. In simple terms, a BMI of 37 may meet the BMI pathway by itself. A BMI of 32 requires a listed condition, and a BMI of 28 requires one of the conditions allowed in the lowest range. Your provider must still document the case and submit prior authorization. There is another detail that could help people who are already taking one of these medicines. CMS says the BMI test is based on the time GLP-1 therapy was initiated, not necessarily the day the prior authorization is requested. Suppose someone began treatment in 2024 with a BMI of 37 and now has a BMI of 34 because the treatment worked. The provider may attest that the person met the BMI requirement when therapy began. That matters because a successful patient should not automatically be excluded simply for having lost weight. If you are already on therapy, ask your provider to review the original starting BMI and medical records instead of looking only at today's number. Now let us talk about the rule that is confusing the most people. The GLP-1 bridge was created for people seeking these medicines for weight management who do not already have a route to the drug through the normal Part D benefit. If you are already receiving a GLP-1 through your Part D plan, you do not qualify for the bridge for that same drug. And if your prescription is for an indication that Medicare Part D can cover, the claim is supposed to go through Part D rather than the bridge. CMS specifically explains that type 2 diabetes, moderate to severe obstructive sleep apnea, and non-cirrhotic metabolic dysfunction-associated steatohepatitis, often called MASH, can be Part D covered indications. There are also certain cardiovascular risk uses that may be coverable through Part D. So imagine two people taking a similar medicine. One person is using it solely for weight management and meets the bridge criteria. The other person is using it for a Part D covered medical indication. The first may use the $50 bridge. The second has to work through the regular Part D plan's formulary, prior authorization, exception, and appeal rules. That does not automatically mean the second person pays more. The Part D cost could be lower, the same, or higher depending on the plan, the drug, extra help, and the person's current benefit stage. It simply means the claim follows a different coverage system. Do not try to change the diagnosis on a prescription to reach the bridge. Coverage has to reflect the real medical reason for treatment, and your doctor must submit accurate information. Now, how do you actually start? First, check that you have eligible Medicare drug coverage. You can look at your plan materials, call the member services number on your card, or call 1-800-MEDICARE. Second, make an appointment with your doctor or prescribing clinician. Bring a list of your medical conditions, current medicines, and any records showing your BMI when GLP-1 treatment began. Ask directly, do I meet the Medicare GLP-1 bridge criteria, and is this medicine being prescribed for weight management rather than a Part D covered indication? Third, if the provider believes you qualify, the provider sends a prescription for one of the eligible products and completes the prior authorization when requested. A pharmacy claim can trigger the authorization request, or the provider can submit the bridge authorization electronically or by fax. CMS says a denial from your Part D plan is not required before the provider sends the request to the bridge. That could save time. You do not necessarily have to force the drug through a full Part D denial process first when the prescription clearly belongs in the bridge. The pharmacy generally sends the authorization request to the prescriber electronically or by fax, often within 24 to 72 hours. After a completed request is submitted, the decision is mailed to the patient and sent to the prescriber, generally within 72 hours. If approved, the authorization can remain valid through December 31st, 2027, including refills and dose changes, unless you switch to a different GLP-1 product. Switching products may require a new authorization. If the request is denied, there is no formal appeal process inside the Medicare GLP-1 bridge. However, the provider can resubmit the form if information was entered incorrectly or if there is additional documentation. That is different from a normal Part D coverage denial, where Medicare drug plan appeal rights continue to apply. Now let us examine the $50 cost, because there are several catches people need to understand before budgeting. The $50 is a copayment for one monthly supply, generally 28 or 30 days. The bridge does not offer 60-day or 90-day fills. If you receive the medicine every month for a full year, $50 per month would total $600, not including any separate supplies or other costs. The bridge operates outside the normal Part D payment flow. That means the Part D deductible does not apply to the bridge prescription. It also means your $50 payments do not count towards your Part D true out-of-pocket total or the $2,100 Part D annual out-of-pocket limit for 2026. This is an easy mistake to make. Someone might pay $50 each month and assume those payments are moving the person closer to catastrophic Part D coverage. They are not. CMS specifically says the bridge copay does not count toward that Part D total. Extra help does not reduce the bridge copayment either. Even a beneficiary who receives the Part D low-income subsidy can still owe the same $50 for a medicine furnished through this program. For Zep-bound QuickPen, pen needles are not covered by the bridge. Those have to be purchased separately. And remember, the single-dose Zep-bound vial and single-dose pen are not included in the program at all. Your regular Part D premium also continues. The bridge does not replace your drug plan, cancel the premium, or remove a late enrollment penalty. You need to keep your underlying coverage active. At the pharmacy, staff may need your Medicare number to process the claim. Only provide sensitive information to a trusted pharmacy or healthcare provider. Do not give a random caller your Medicare number or financial information because the caller promises guaranteed approval. There is also a medical reality behind all of these coverage rules. $50 access does not mean the medicine is right for everyone. These are prescription drugs with significant warnings and possible side effects. Common effects listed in official medication information include nausea, diarrhea, vomiting, constipation, abdominal discomfort, and indigestion. The individual products also have important warnings and contraindications that your provider must review. Tell every treating clinician what you take, especially before a procedure involving anesthesia. Do not start, stop, change doses, or switch products based only on a video or price announcement. The bridge also requires ongoing nutrition and physical activity support, not a prescription with no follow-up. Let us go through the most common mistakes one more time. Mistake number 1 is assuming every Medicare beneficiary qualifies. You need eligible Part D coverage and you must meet the clinical criteria. Mistake number 2 is assuming every weight loss drug is included. The current list is Foundayo, Wegovy, and Zep-bound QuickPen in the specified formulations. Mistake number 3 is using only your current BMI. If you already began GLP-1 therapy, the relevant BMI may be the number at the time treatment started. Mistake number 4 is assuming diabetes or sleep apnea automatically helps you enter the bridge. Those diagnoses may instead place the prescription under regular Part D coverage. Mistake number 5 is expecting the $50 to count toward your Part D deductible or annual out-of-pocket maximum. It does not. Mistake number 6 is expecting a 90-day supply for one payment. Bridge fills are limited to one monthly supply at a time. Mistake number 7 is giving up after an authorization denial without checking the reason. There is no formal bridge appeal, but the prescriber can correct the form or resubmit with additional information. Here is the checklist I would use today. Confirm that you have Medicare drug coverage. Find your most recent BMI, and if you already use a GLP-1, find the BMI recorded when treatment began. Write down any qualifying conditions, including prediabetes, previous heart attack or stroke, symptomatic peripheral artery disease, heart failure with preserved ejection fraction, uncontrolled hypertension, or chronic kidney disease. Then ask your provider whether your prescription belongs under regular Part D coverage or the Medicare GLP-1 bridge. If it belongs in the bridge, ask whether the prior authorization has been submitted, when it was submitted, and whether the pharmacy has the correct Medicare information. If you have questions about eligibility or the status of the authorization, call 1-800-MEDICARE. You can also use Medicare's official online GLP-1 bridge eligibility questions and speak with your local SHIP counselor for free, independent help with Medicare coverage. The most important fact is this. Beginning July 1, 2026, eligible people with Medicare Part D can access certain GLP-1 weight management medicines for a predictable $50 monthly copayment through a temporary nationwide program. But the benefit is targeted, not universal. The plan type, the purpose of the prescription, the medicine and formulation, your BMI at the start of therapy, your qualifying conditions, and the prior authorization all matter. Share this video with someone who has been paying cash for a GLP-1, someone who was previously told Medicare never covers weight loss drugs, or someone who stopped asking because the price seemed impossible. They may not qualify, but now there is an official pathway worth checking. Subscribe for verified Medicare and Social Security updates explained in plain English. I will see you in the next video.